But earlier today, I did talk to Dr. Sujatha Reddy about the mysterious illness affecting children and all of the signs parents need to look out for.
There is this rare complication that's sending the children's immune system into hyper overdrive that is causing some serious complications.
So far, more than 100 cases of a serious illness were linked to a rare complication called pediatric multisystem inflammatory syndrome. The sickness, believed to be related to COVID-19, causes inflammation in the body and heart of children.
And with a lot of things with COVID-19, we're just now learning about this.
The symptoms can look like other commonly known inflammatory diseases, like toxic shock syndrome and Kawasaki disease, which also mainly affects children under the age of 5.
Children are getting severe abdominal pain, possibly a bright red rash, possibly like red eyes, like pink eyes or irritated eyes.
Other symptoms include fever, swollen neck glands, swelling of the hands and feet, and cracked lips. Right now, the CDC is working on criteria that can be used nationwide for the new illness. So far, medical experts say it's difficult to know which kids are most at risk of developing these severe complications. And the illness is rare, so Dr. Reddy called that a silver lining. Now, as for the patients at Children's Healthcare, they're going to be tested to see if they are positive for COVID-19. If they are, then they will continue to investigate to see if there's any link to that new illness.
All right, parents are going to be watching this one closely. Thank you, Hope, for that informing information.